When it comes to the coronavirus, this team is all about facts, not fear. And tonight we noticed the number of new cases is starting to climb in some areas, including DC. John Henry joins me now with some context for these numbers. John, you had a chance to take a look at them. So what did we learn?
Well, here's the bad news first, Leslie. DC Health data shows cases are on the rise in the district. Matter of fact, you can see it they're at their highest point since the Omicron surge back in the middle of January. That's all led to DC to declare itself as being at a medium COVID community level. The CDC uses these levels to decide what steps communities need to take to stop COVID's spread. They can either be low, medium, or high, and are based on weekly case rates, the number of people in the hospital, and the percentage of hospital beds being used in a community by COVID patients. So here's the good news. In DC, both those hospital numbers are practically zero. It's a similar story in Arlington, too. The subvariant spread has increased weekly cases there, but not hospitalizations. The CDC identified Arlington as being at a medium COVID community level. It's the only community in our region the CDC has given that designation. Arlington health leaders said ongoing transmission, increased testing due to holiday travel, and a delayed reporting of some cases have led to their local increase. Dr. Stuart Ray, a professor of medicine at Johns Hopkins, says people shouldn't avoid Arlington or DC, but they should use caution whenever they're there.
I think that it's clear that masks work, and so personally we can manage that.
As for what he thinks of mandates,
I think at an institutional or municipal level, there are difficult calculations to make about what's going to be most effective in terms of messaging and in terms of mandate. People are pretty fatigued of mandates, I think, as all of us have recognized. And so there's a management of risk that an institution or a municipality has to deal with.
Now, some experts also think COVID cases are being undercounted across America. On Sunday, Dr. Scott Gottlieb, former head of the Food and Drug Administration, told Margaret Brennan on Face the Nation many people are using at-home tests and not reporting the results to health agencies. Leslie?
Yes, so it's possible we may not actually know the true scope of that number. All right, John, thank you.